My name is Chelsea Cavenor. I'm with Proactive Rehab. We have 4 clinic locations and we have 16 providers altogether. Right now, we are all PT and PTAs. We are looking into OTs possibly in the future, but we're not quite there yet. We've been in business at least 20 years. I believe it's 21 years now. I have been with the company 15 years. Um, we previously were in Net Health for our EMR system. We started with Net Health back in July of 2012, so we were with them quite some time before needing to make the switch. One of the biggest reasons that we were looking to switch was because the physical therapy side of Net Health is going to be no longer after the end of this year. They're going to be shutting down that portion of it to focus on other things. And we had been having issues with some of the workflows as far as the billing side of it and just the ease of working with it. Some of the documentation for our therapist was kind of bulky and just kind of a nightmare for them to get through notes. Wasn't capturing charges very well, wasn't helping us to make sure that we were charging for everything that we could charge for, when appropriate. So there's some barriers, and some of the enhancements that they were looking to create for us just weren't happening. They weren't working. A lot of bugs, a lot of issues, and customer service was dwindling down. So our owners and managers had gone to a private practice summit and were reviewing several different new EMR systems, one of which was SPRY. And we went through a demo. Actually, I went through about 4 hours worth of demos with SPRY, and all the things that it had to offer sounded great for our company, a lot of customizable options for us. So that's where we ultimately decided to go with SPRY. Our initial go live date was on February the 15th. We had some bad weather and such here, so we pushed that back to March. So that gave us about 6 weeks to get everything moved from Net Health into SPRY, all the training, all the background pieces, and there's a lot to it. And it was completely doable. Like say we had Aparna was our customer service manager, I guess is what her title is, and she was fantastic. She helped with every aspect of it, getting all the pieces of information needed to get everything set up correctly, getting all of our users in, all of our coding and insurance, billing, documentation requirements, setting up all the training. She handled all of it so very well to where there's still a lot we had to do, but she took care of a lot that we probably didn't even know she had to do for us. And then we had a Perba that handled a lot of the migration from Net Health, getting everything pulled over. And honestly, Net Health did not make that the easiest process to get that information, but they handled it very well, very professionally, and were able to get all of our information, all of our patients pulled over in a very usable format and manner. Our biggest fear was just making sure we still had our information because, legally speaking, you have to keep patient information, billing and documentation wise for a number of years. So we were worried about not having all of that information. On the AR side, we were worried about losing a lot of money. So right now we do have both systems still going. Our Net Health, we are still working on the AR, getting all of it resolved, which we're getting there quickly. And then in SPRY, we were worried about how that would work, how long of a gap it would be before we started seeing payments. And honestly, it was very quickly. Claims were going through clean and quick. So a lot of those worries weren't as big as what we initially feared that they would be. The customer service has been fantastic. We've had to reach out because we have 110 questions and then some. So we've reached out a lot, but there's been so many opportunities for us to ask any questions and get them answered. There's been additional live links. I don't know what else they were called, but like kind of a help webinar that were created for us to where we had all day. We could log on, ask our questions, get an answer, log back off, continue working until something else came up that we needed asked. And that was amazing. That was very helpful to be able to just stop in the middle of what you were doing, ask a question, get an answer, and move on. That was very much appreciated from everybody on our team that was learning SPRY. Since then, we have the Slack channel, which we use a lot. We've asked a whole lot of questions there. Some are ones that we probably already knew, but there's so many new things that you kind of forget those small details. But they've been nothing but helpful on just reminding, this is here, or you go there to do that, or, whatever we need. They've been very responsive and very helpful to us in making the whole transition very easy, very easy. previously, even just getting faxes, let's start there. We're still using our actual printer fax machine to get faxes. Now with the e-fax option that's available through SPRY, we are able to get all of our referrals and plan of cares and all the things that, each time took an extra minute or two to process or get them back in the system, have to scan them in and attach them. But just shaving off that much time for our front desk has saved them a lot. It's all right there. You don't have to worry about, did the fax go through or did it not? It's all in a dashboard. Has saved a lot of time. The online paperwork for patients to be able to fill out ahead of time has been great. You send it to the patient, saves them time whenever they come in for their appointment. They don't have to arrive as early. They can fill it all out at their convenience. It pulls right into our system. We can just review it and make sure it's all there. The information they enter in for their medical history pulls right into the note for the therapist. So a good portion of their note is already done by the time they get in with the patient. And it saves a lot of time to actually listen to the patient, listen to their history, get a better game plan going of, this is what your injury is or what your situation is. This is what we're going to do to treat it. This is how long it may take. Just stick with us. And it helps a lot, I think, to get the patients through their care in a better way, a clearer way. And even into the documentation, some of the dictation that they're able to do to kind of record, and it picks up on a lot of the comments that might be made by a patient. It picks up on those where a therapist, and not that they miss them, but sometimes you can get a whole lot of information and it feeds into the note to get a better, clearer note for that patient. Even with the charges that the therapist is able to enter, the flags that SPRY gives, like, hey, you're missing that, or, don't forget this code, stuff like that, helps on the billing side to capture all of the charges. I mean, it's not all about money, but in the end, we still have to make payroll, still have to pay bills. So that's very important to capture all of those charges. And then when those claims do get billed to insurance, the whole billing dashboard, all of the different buckets that claims can go into at different stages of their billing process is very clear. It's very helpful to see this is exactly the issue. If there is an issue, this is how you fixed it. It's easy to resubmit those claims. It's easy to see, once it's been paid by insurance, this is what was deductible. It's all just very clear. So I think it helps make things a lot cleaner and quicker turnaround times from the whole intake process to billing process to treatment. The whole thing is just a lot more seamless. The only thing is SPRY is so customizable. It's a little inundating to be able to choose so many different options because I mean, even from the beginning, there's things that we thought we wanted this way. And then as we got into it a little bit deeper, like, no, that doesn't make sense. So we had to change it back again. But then it's great to be able to create your own system, essentially, to make things work better for you, your company, your therapist, your patients. I mean, it's worth it in the end. Change is hard. It's hard for anybody, no matter how much you embrace change. There's still that unknown that's out there. The only thing I would say with SPRY is really get in and ask the questions. Like I say, I had 4 hours worth of demos with various parts of the SPRY system. All of my questions were able to be answered. It's a very user-friendly system, so it is definitely different than our old EMR, but it's very easy to get in and find your way around and see what's what with all the different options that are there. I would just say ask the questions, any of them that you have. You can get in and customize it all too. So if something doesn't quite work the way that you would like to in your noting, your documentation, it can be updated. It can be changed. They're willing to work with anything that you ask for. The customer service is far better than what we've had in the past with our past EMR, and that says a lot. That means a lot. Day to day with Net Health, we had the system so long, you just kind of get used to what you have. Like you just get used to it, even if there's better out there, you just don't really know any better. Now the day-to-day with SPRY, it's a lot clearer. The workflows are clear, even as far as the patient check-in, taking payments, verifying insurance. That's a huge thing. You can verify any visit. Somebody comes in and they're like, I think I've met my out-of-pocket. You can check that form very quickly. That helps a lot on the patient side, their satisfaction. The documentation with the therapist is a lot smoother. They're able to document a lot faster. So they're not spending a lot of their time in the office away from patient care. They're actually working more one-on-one, which gets patients, they feel better when they're getting that closer attention. And they feel like that it's helped them progress patients quicker than what they were before. The billing, is all smoother. It's all quicker. So it's made the workflow for all aspects so far. We're still new to it, but even that says a lot too for only being in the system completely for a month. For things to be smoother, it's helped. It's helped a lot. The team was okay with it. I mean, they understand if that's the system we're going with. They jumped in. We've had a lot of training, still are having training as we go through claim submission and denials or rejections, all of that. It's just a different system, but it's so user friendly and easy for them to navigate through. And again, the customer service has been helpful that it's really not been that bumpy of a transition. No, I mean, the migration was a little scary at first, but honestly, SPRY handled it all. We didn't have to do much. I mean, we didn't have to go in and worry about stuff not being there or worry about missing patients or missing information. I mean, it was all handled on the back end from SPRY to where it was a lot of peace of mind on our end.